welcome you to True Sets Free, a ministry or a platform that is dedicated in sharing the health message and also the three angels message. Now, I would advise you to subscribe if you've not yet subscribed, and also I would advise you to watch the previous videos that we've recorded on diabetes. In the previous two videos, we talked about how the body works and how diabetes develops. We also gave a recommendation, or rather we talked about the food that diabetic patients are supposed to be eating. So we are going to review and just go a step further. So we'll be talking about diabetes. We will do a continuation of the video that we did on diabetes. So we are talking about diabetes type 2. That's what we are dealing with today. So you remember pretty well that in our previous lecture, we talked about a diet that a diabetic patient should consider. And in that diet, we said the patient should be on a diet that is high in protein, high in fat. So a diet that is high in fat. They should also include in their diet proteins, slightly high, not very high, but they should include proteins in their diet. They should also, if they are to include carbohydrates in their diet, they should make sure that their carbohydrates are less than 50 grams per meal. So their carbs should be less than 50 grams. That's the amount of carbs they should be taking. Now, obviously, many of you were wondering in that video, or rather in that lecture, why should a diabetic patient be on a diet that is high in fat? We know pretty well today that fat is the boogeyman. Fat is the scapegoat. When we talk about fat, even when you go in rural areas, when you go in urban areas, you will find that almost everyone will tell you that if you want to avoid various conditions, various sicknesses, you should reduce the amount of fat that you take in a meal. Today we are told to say cardiovascular conditions come as a result of taking a diet that is rich in what? In fat. But then the question is, where is the problem? What is the problem? Is it the bread or the butter on the bread? Figuring out which one is more dangerous will help us to know how a diabetic patient actually is supposed to eat. Not only a diabetic patient, but how we are supposed to eat. When you go to the hospital today, a nutritionist is going to tell you, okay, you've been diagnosed with diabetes. So what you'll be doing is this. Firstly, stop eating white bread. Secondly, start eating brown bread. We are going to talk about brown bread in the coming lectures. You wouldn't want to miss that one also. So why is fat the boogeyman today? Why is supposedly science telling us that we should not be eating a diet that is high in fat? And one interesting thing is, as you watch these advertisements, when the healthy people are trying to advise us to go to the low-fat diet, and when they are telling us to stop eating a diet that is high in fat, you find them advertising, showing us the foods that will make us have cardiovascular conditions, that will make us obese, that will make us have diabetes. And when you look at those foods, have you noticed something? That actually those foods, many of them, they are carbohydrates. But they are contradicting themselves. They are showing us in their videos and in their pictures that we should not eat foods that are high in fat because they will cause cardiovascular conditions. But in their pictures, in their videos, they are showing us carbohydrates. They are showing us chips. They are showing us bread, they are showing us a lot of biscuits. When you look at all those, you find that those are foods that are high in carbohydrates. So this fat that we are talking about today, a fatty diet. So Dr. John Abramson once said, you know, fat is an enormous and complex molecule, and to radically think, or to think that we can radically pull it out from the body is actually ridiculous. It is bad science. So when you think of this fat, when talking about this fat, you get to realize, let me just give you some points, just give you a gist of what fat is. Your cell membrane integrity. Your cell membrane integrity, it is supported or it is enhanced by fat or cholesterol. When you talk about your joints, they need lubrication. They need some oil, your skin, your hair. They all need, even your eyes, they need oil, cholesterol, which is fat. Your vitamin A, your vitamin D, your vitamin K, these are fatty soluble vitamins. And these fatty soluble vitamins will not be absorbed unless they are absorbed, unless fat is there. When we talk about the electrical activity in your nervous system, it uses fat. Fat plays a very huge role. It uses fat. So, when we talk about fat, your body actually produces 80% of the fat that is in your body, your cholesterol, is actually from your body. This is predetermined, it's genetically predetermined. Your body just works and produces 80% of fat. The remaining 20% is what you do take through food or from food. You take the remaining 20% from food. You also need to remember that when we are talking about fat, actually you get to realize that your brain, 25% of your brain is DHA, docosahexaenoic acid, and this is actually a polyunsaturated fatty acid, so it's also fat. You'll find that when we are talking about the retina, your eye has DHA, which is fat. So now tell me, are you going to be alive by the time we are done removing your fat? Are you going to be alive if we lower your fat to what the health institutions are telling us, to lower it to somewhere around, like they tell us, to somewhere around 4 or 3.88 millimole per liter? Do you think you are going to be alive? And already the amount of fat that is produced by the body, it tells you exactly that your body needs cholesterol. It needs a huge amount of cholesterol. Obviously, it doesn't need an abnormal amount, but your body without fat, you will be dead. So, promoting a diet that is actually high in carbohydrates and low in fat is actually A wrong idea. And do you know where this came from? In the 1977 and 1983, both in America and UK respectively, an advice was given after a research when they were trying to look at some cardiovascular risk factors. They gave an advice saying fat is one of those foods that, actually one of those nutrients that would increase the risks for cardiovascular conditions. Therefore, we should lower our fatty level or our cholesterol level very low. In short, our meals should we should subsist on meals that are low in fat. And do you know what happened from that time? What happened from that time is the amount of carbohydrate that were being taken started going on the rise. And when the amounts of carbohydrates started going on high, when they started rising, what was happening is that we've noted that actually cardiovascular conditions that many people are suffering today increased. Heart attacks increased. Strokes increased. Obesity increased. Diabetes increased. All these conditions, we start noting a rise in these conditions after an advice to lower the amount of fat. And when you lower the amount of fat, which is actually a very good source of energy for the body, like we learned some other time in the previous lecture, when you lower the amount of fat, your body starts working specifically on carbohydrate, because the body will actually prefer using glucose as a fuel, carbohydrate mostly. So, and we see these things begin to rise. And when these things begin to rise, the blame again is cast on fat. Then there should be something. There should be something. And you know what they have been doing? What they have been doing is they have been making sure that the amount of fat is lowered. But even as they lower the amount of fat, they realize that there is no change or recovery in the number of people that are suffering from cardiovascular conditions and also from diabetes. They have increased the amount of carbs or carbohydrates. You know what insanity is? Insanity is doing the same thing over and over, yet expecting different results. That is insanity. You keep repeating the same thing. If today you get A, you do the same thing, you want tomorrow you should get B. That is insanity. You will not get B, you will definitely get A. And that's what is happening with a low-fatty diet that they are propagating. Now, when we talk about dietary fat, we can talk about it in three forms. There is what is called saturated fat. Saturated fat. There is also what is called monosaturated fat. Monosaturated fat. There is also what is called polysaturated fat. Polysaturated fat. So whenever you are eating foods that have got fat, it's either the food that you are eating will supply you with saturated fat, or supply you with monosaturated fat, or it will supply you with polysaturated fat. Some other foodstuffs have got all of these components, or they have got all of these. So, what about the killer fat? So, the killer fat, what is known as the killer fat? This is the killer fat. The various toxins, substances that are toxic in nature, when they penetrate into an animal, they prefer residing or finding an habitation in the adipose tissue or in the tissue layer, in the fatty tissue layer. So, oftentimes you'd find many toxins from the environment. Think of any toxins. Toxins we get from detergents that we use in washing. toxins we get from the industries when the industries are producing all those fumes, all forms of chemicals we get from whatsoever you can mention them, the chemicals that we give to our animals, the chickens that we eat, the cattle, the pigs. You know, nowadays these are supplied with various chemicals for them to grow within a shortest possible time, and for the producers to make market and to make profit and to reduce on the amount of losses. They will supply these animals with chemicals. Now those chemicals, they go and get stored in the fatty tissue. So if you want to get your fat, from animal, you will be very much predisposed to having a number of conditions, because the fat in animal is actually most of the time is contaminated with very toxic chemicals. No wonder people have cancers, the people have tumors, people have all kinds of things, the immune system being weakened. So getting fat from animal is what I will not recommend in this lecture. I would recommend that you get your fat from the plant-based diet, from a plant-based diet. That's what I would recommend. So let's talk about saturated fat. Is saturated fat an enemy or a foe? Is saturated fat a foe or a friend? That's the question we need to answer today. Is saturated fat a foe or a friend? Now, saturated fats, when we talk about saturated fat, this is what we need to talk about. Why is it called saturated? So it's called saturated. I'll give you an example of what is known as butyric acid. This is a saturated fat. So this is what they mean when they say saturated fat. When scientists did an experiment and looked at the structure for saturated fats, they noted something like this. So this is the structure for butyric acid. So when they did all their experiments, they noted that a saturated fat has got no double bond between one carbon atom and another carbon atom. And because of that, these fats are mostly rigid. These fats are hard. These fats are solid at room temperature. And it's very hard to play with their structure. And now, these fats, this is what scientists tell us. They tell us that these fats, because of their nature, they are the ones that increase the level of LDL, or what is known as bad cholesterol, low density lipoprotein. So they say low density lipoprotein is bad cholesterol. And they say when you consume too much saturated fats, an example, butyric acid, when you consume too much of saturated fat, what is going to happen is that the saturated fat is going to increase the level or amount of low density lipoprotein cholesterol, and they call that bad cholesterol. They call it bad cholesterol, or LDL. Now, what is LDL? What is LDL? We said low density lipoprotein. So what happens is when your liver in your body produces fat, and that fat, when it's produced, it is stored in the liver. And when it's stored in the liver, when a need arises that fat needs to be used in various tissues, in various cells of the body, a signal is going to be given to the liver so that this fat that is stored is put in the blood and taken to where it's supposed to be, the target organs, the target site where it's supposed to be. But you remember very well that fat does not dissolve in water. So what will happen is that when that signal comes to the liver, there are proteins that are called lipoproteins. These proteins, what they do, they are the ones that carry the fat in form of cholesterol. So they will carry the fat in form of cholesterol and they will go into the blood. And they'll be able to transform this, to transport this fat. They'll be able to transport this fat to the target organ. Now, when they transport this fat to the target organ, what happens mostly is, scientists will tell us that if this is your blood vessel, and in your blood vessel you've got blood that is moving, and blood will consist of your platelets, blood will consist of your red blood cells, blood will consist of your plasma. So the low density lipoprotein, which is known as bad cholesterol, it is called bad cholesterol because of the following. So if there is a cut in your blood vessel, what happens mostly is this low density lipoprotein, as it is being transported in your blood vessel or in the circulation, it is going to deposit, or it will find itself in the endothelium, the inner lining of this blood vessel. And when it finds itself there, it will start lowering, or it will start reducing the lumen of the blood vessel. So now, blood that is flowing in the blood vessel, what will happen is, it is going to find it difficult to pass through this narrow lumen. And because the lumen here, it is very narrow, what happens is, the pressure of blood in the blood vessel will increase. The heart, which is pumping blood, is going to increase the pressure. It's going to pump so hard so that the blood that is passing in the blood vessel will overcome this obstacle here, or this resistance, and hence rising the blood pressure. So you've seen, because the low density lipoproteins, they go into the endothelium and actually form a plug somewhere there. Scientists tell us that this is the disadvantage for having this, because when this breaks, it can embolize. It can embolize to the brain and cause a stroke. It can embolize to the lungs and cause pulmonary, or what is known as pulmonary embolus. It can embolize to the blood vessels, or the coronary blood vessels of the heart, and actually cause a heart attack, and hence increasing cardiovascular conditions. Now, look at how things work. Sometimes the body actually is very smart and thinks very well compared to so many scientists. God did not create anything that is bad, such as bad cholesterol. The reason why the body produces this cholesterol is for a very, very, very good reason. And this is the reason why. So, if your blood vessel is intact, let's say your blood vessel is intact, and because your blood vessel is intact, what will happen is, if you've got something like hypertension, high blood pressure, because the blood is passing at a high pressure in your blood vessel, that high blood pressure is going to cause a tear in a blood vessel. And when there is a tear in this blood vessel, signals will be sent to the brain, and the brain will tell the liver that you need to produce low density lipoprotein, because God wants low density lipoproteins to be produced. So produce low density lipoproteins. And when these low density lipoproteins are produced from the liver, what will happen is they will go in the circulation, in the blood vessel. They are the main reason why low density lipoproteins have been produced, is because they want to come and seal and fix this tear that has been made in the liver, in the blood vessel, so that blood does not move out of the blood vessel. this vessel should not burst. Because when this vessel bursts, what will happen is blood will seep out from the blood vessel, and the amount of blood that is circulating in the body, it is going to reduce. When the amount of blood circulating in the body reduces, the end result is the amount of blood that is going to return to the heart is also going to reduce. That's what they call cardiac input. And when there is a reduced amount of cardiac input returning, or blood returning to the heart, you will find that also the blood that will go out of the heart, what they call the cardiac output, will also reduce. And you will go in what is known as a hypervolemic shock, meaning your tissues, the cells of your body, they will start lacking blood. And when they lack adequate amount of blood, they will lack oxygen. When there is no oxygen, your cells begin to die. Now, the body, because it's smarter than many scientists, this body is going to produce low-density lipoprotein. And when it produces low-density lipoproteins, the lipoproteins are going to come and seal this blood vessel so that the blood vessel does not burst and that blood does not seep out to protect you from something like an hypervolemic shock. Now, the problem then, it is not the low-density lipoprotein. The problem is what caused the tear here. Because if the tear had not happened here, you would not have this high low-density lipoprotein. So the problem here is high blood pressure that caused this tear here. There are also chemicals that infiltrate our body and they attach themselves to our endothelial cells of the blood vessels, and when they do so, they attract low density lipoprotein. So eliminating high blood pressure is key. You should not eliminate low density lipoprotein. Eliminate high blood pressure. Eliminate those chemicals that cause or attract low density lipoprotein. What we are going to do now, we are going to pause from here. Join me in the second part as we now show you the statistics and also some research that show that there is actually no association between low density lipoprotein, a rise in low density lipoprotein, and cardiovascular conditions. So we are going to do show you some research and the various data that is available out there.